I'm going to concentrate primarily on two pivotal trials performed with rituximab in systemic lupus. So there's a fish problem. There's a big fish problem out in the Midwest. Carp are invading the Great Lakes. And I ran into a different kind of fish that's causing a problem, and it's this fish. This is the wolf fish that I photographed in an aquarium on the west coast of Norway. And this fish is all about lupus. Look at it. It's got lupus in its name. It's got immune complexes, and it starts with ANA. For the non-clinicians in the group, this is what we're up against. A very challenging disease, very heterogeneous disease, all different kinds of rashes, many different kinds of vascular problems, many different kinds of musculoskeletal problems, nephritis. And if we're not dealing with complications of the disease itself, we're dealing with complications of the therapy we use to control the disease. And this slide shows osteonecrosis of the hips, a complication of high-dose steroids. We have come a long way. In the pre-steroid era, going back 60 years ago or more, patients did not do so well. But with the introduction of steroids and cytotoxic agents, patients are surviving a lot longer. But until this line is perfectly flat, we have a ways to go. And how are we going to achieve that? We need new therapies. We need safer therapies. We need more efficacious therapies. And this is my cartoon. This is my rendition of the immune system in lupus. Usually I show it in animated fashion, but to save some time, I took out the animation. And many of these players are the targets for the development of therapeutics. I'm going to focus on the B cell itself. In order to understand about the trials that I'll present a little bit later, I just want to review issues with trial design and some of the disease activity indices that we use. There's no question that lupus is a real tough nut to crack. It's a heterogeneous disease, as I mentioned. There's no gold standard responder index. The people in rheumatoid arthritis are very spoiled. They have a responder index, and you can study any drug and just plug it in. But they were at our point maybe 10 years prior to where we are with lupus. They struggled with responder indices as well. The background therapies that we use in lupus are highly variable. And up until recently, no phase 2 or phase 3 trial met its primary endpoint. It was very frustrating. And why is that? Is that because the drugs are ineffective, or are we ineffective trial designers? And we'll address a bit of this. So just to talk about trial design in lupus, there's some key variables. One is the target population, and the other is disease activity. And when I talk about target population, there are two options. One can study patients who I call it global. Basically, they enter a study with any type of background disease activity. So you can enroll patients who have arthritis, patients who have rash, and that I'll refer to as global.